Hi, this is Melrose Mayor Paul Brodeur. First off, I want to thank the families of Melrose for their extraordinary efforts over the weekend to remember our fallen this Memorial Day. We had obviously a very challenging set of circumstances. We couldn't really outwardly express our thanks and lend a shoulder for folks to lean on. But the community, as always, very much did come through to honor those who have fallen and the Gold Star families, and to honor their memories was very, very important and very, very well done. Now that Memorial Day has passed and some of the regulations around openings, particularly around businesses, have changed, we are excited for that new change. We want to remind everyone, however, that all the social distancing protocols and mask wearing protocols are still in place, and remind people that when you wear a mask or take those precautions, you're not just doing it for yourself, you're doing it for your loved ones and the members of the community by protecting them as well. And a really important update is the next segment of the broadcast here is to check in with MelroseWakefield Hospital. As you know, they are a flagship healthcare provider here in the city and have been doing incredible work, both getting ready to treat patients with COVID, stepping into that brave new world, and also continuing the high quality care that they have had to continue to provide all along the way. And I'm delighted to welcome to the broadcast Sue Sandberg. Sue is the CEO of Melrose Wakefield Healthcare. I think she's been with us maybe a year, probably feels like a couple of decades at this point. Sue, welcome aboard Zoomland. It's good to see you.
Thank you, Mr. Mayor. I'm very happy to be here. I mean, you're going to be talking on a subject that's near and dear to me. So
I think it would be really helpful. Oh, sorry. These are so hard to coordinate.
As a nurse, more than as a hospital administrator, what we're going through right now is something I never expected to face in my career. It's made me even more proud to have been a nurse, to have gotten where we've gotten through this pandemic, and am delighted to be here with you today.
Can you take a few minutes to fill folks in on your background? As that nursing background, particularly in this current state of affairs, is just huge and is a tremendous source of information to draw on. But you're also not new to the world of hospital administration. So if you want to take folks through your resume a bit, I think they'd be delighted to hear about your experience.
Sure. I've spent my career working in community health care. I'm a farm girl from Minnesota and have been doing this for over 30 years. So a difference now compared to when I first became a nurse was HIV was the big communicable disease back then. And it's interesting how the world changed as a result of that. Things that were put in place within hospitals and throughout the United States and the world to help prevent the spread of HIV. How about the way we wear gloves if we're going to be around body fluids, touching blood? There's just so many things that weren't in place when I first became a nurse. And I think now 30 years later, still working in community hospitals, which is what I love. I love doing care close to home, close to families for people. And to now, I think there will be many changes on the other side of this pandemic that will become second nature to us in light of this virus coming to the world out of nowhere.
Can you take folks through what it took to get ready? Because it really was almost a complete change of your mission, of the nature of the care you provide, the precautions, the floor plan, really everything. And it was all under the gun.
Sure, and the good thing, as opposed to China, is we had some forewarning this was coming. We saw what happened in China. We saw what happened in Italy. We saw what happened in Seattle and New York as it advanced across the globe to us. And so we knew there was going to be a virus that not a person on earth had immunity to. And we know we have phenomenal health care in Massachusetts, but we also knew that no one in the state had immunity. So we knew we needed to be prepared for a virus to come. So I would say there was a lot of preparations in the hospital because COVID patients, the disease is spread by droplets. and that's airborne. And so there needs to be a unique kind of isolation used with these patients. And it's called negative airflow isolation. And before this pandemic started, we had 6 rooms to cover this type of a diagnosis at Melrose Wakefield. One would normally see them used for other airborne diseases such as measles or tuberculosis. And so we knew we were going to be seeing a lot more than 6 patients. So we had to re-engineer wings of the hospital to ensure we had separate, isolated areas for COVID patients, to ensure we were keeping this virus in an area with patients that already had it, rather than having it spread to either our workers or to other patients and visitors. Even at the peak of this virus, we had more non-COVID patients in the hospital than we had COVID. But it was about a month ago today that we were at our peak COVID. I think more importantly, in preparing for this, it wasn't just what happens in a hospital, which is usually what happens when you think of a heart attack. It's how do you get the person to the cath lab and the care in the hospital? In going after a virus like this, look at all the work you and the community did to prepare. You know, teaching people about social distancing, teaching people about hand washing. And I know it's become second nature to you to lead our city in.
I don't know about that, but thank you.
It comes out naturally with you. I really think that's made a difference. And it's really helped us from being more overwhelmed. A month ago, we were really, really, really busy with COVID. And today we had 14 COVID patients. That's a huge difference. It's much more manageable. The challenge with COVID is the patients are very, very sick. And they take a lot more resources than a normal patient. I've heard so much, well, it's a type of flu. What's the difference? The challenges these patients face when they are hospitalized are much more resource intensive in terms of time on ventilators, but mainly in terms of the amount of caregivers it takes to give care. These patients, if they're on a ventilator, do really well if we do something we call proning them. We put them on their stomachs so their lungs can expand even a little bit more. We need every little bit we can in those lungs. That sometimes can take 8 people to turn a patient who is paralyzed on a ventilator, so the vent is breathing for them, to turn them onto their stomach. So again, very resource-intensive care.
And the social distancing piece is so important and continues to be important. That's one thing I don't want people to take away from this, that, you know, you said our peak was around a month ago. You are not suggesting that people step away from any of the precautions that hopefully, like you said, are second nature at this point.
Absolutely. There's a real danger if people step away. Again, this is called a novel virus. We don't have immunity. So for us to have immunity, we're either going to need a vaccine, or there needs to be enough people who have had it that have, we call it then herd immunity. We are nowhere close to that. So the real danger with this is that if people are out interacting and forgetting social distancing and maintaining that distance, forgetting about everybody wearing a mask out in public, and forgetting about the importance of hand washing, this virus is aggressive and it can spike up again. And I hope that we've learned this and it's become second nature to us. That would be a real shame if all we do is peak and overload the healthcare system again, because that is the real danger. While the virus is still alive, it is still out there in our community. It's just not as widespread because the work everyone has been doing to try to tame it right now is working.
So 2 things I want to ask you about that are a little bit outside, you know, the ED and the ICU, and those are your efforts to help not just yourselves, but the community with mask recycling when PPE was really, really difficult to get. And I also want to talk a little bit about the testing that you offered to first responders. So if you want to start with the masks.
Sure. People will say, what was your biggest fear? What kept you up at night when you knew this was coming? I would wake up in the middle of the night always worried about PPE. Remember, I'm a nurse. I've been at the front lines. I could never, ever ask a nurse or a doctor to go in and not have PPE. And I actually spent time talking to legislatures and stuff was coming, saying, we're going to need help. We need PPE. The analogy that was given, you can't send a soldier into battle without a gun and bullets. And you can't send nurses and doctors into care for a virus like this that transmits easily and just expect them to go in and care. Because what would happen if they were brave enough to do that is they would most likely catch the virus, and then who would be caring for sick people? So it's very important to ensure that the caregivers have the right PPE. So I increasingly was worried early in this when the CDC came out with a statement that actually gave us permission to use fabric masks if we ran out of normal PPE. And that's how tight the supply chains are and were. Supply chains right now are opening up. What's different is the price has gone up. Masks that used to cost, a few cents are now over $1. N95s, which used to be, less than 50 cents, now can be over $5. So the price has gone up because of the supply and demand. But we did ask people to start sewing fabric masks for us because I was worried, what if that's all we have? And a fabric mask is a very important piece of PPE. It's not the appropriate PPE if one is in the room doing aerosolization procedures with a COVID-19 patient, during an intubation, during a respiratory treatment. One then needs an N95 mask because that has the filtering for these particles too. But the other masks are very important for all of us to use because the purpose of them is to hold the droplets to us and not spread it throughout the community. And healthcare workers need to be wearing those masks too. Just because we're nurses and doctors and pharmacists and housekeepers, we also can get the virus and spread the virus. So it was real important we also had masks so we weren't making our well patients sick or our families sick. And so that's where the fabric mask came in. We actually have not had to resort for those in use for patient care, but we certainly have given them out to our employees to wear to and fro work because masking is important right now and we need our employees to stay healthy and not contaminate other people. We're also using those in some of our areas of the hospital that can't work from home but aren't in the front line of patients, such as our finance team. A lot of them are working from home. Some of them have to be in the office because of the type of work they do. They wear the fabric mask just like workers will going back to work when you hear about in other buildings throughout Massachusetts as Massachusetts is opening up again. So we were deep gratitude for the sewers who came to our need. And they also came to us with head coverings. Head coverings that staff like to wear in COVID units were becoming short supply. Anything necessary to take care of COVID patients all of a sudden became in short supply. And these phenomenal sewers in our community also started sewing those for staff too, which was remarkable. And I think you've seen anyone seen the button tricks about putting buttons on headbands so that these masks don't start to hurt one's ears? I do believe I now have, calluses behind my ears because I wear a mask all day. I'm in my office alone, so I'm not wearing my mask right now, but we all wear masks here. And the same thing, that those headbands with the buttons are just another game, saver when one's wearing a mask all day long.
It's funny, but the one of the things that struck me about the cloth, or two things that struck me about the cloth mask is the way the community rallied, which is really just outstanding, but also kind of brought home how serious and different this is. I traditionally think, all right, if I'm going into the hospital, that's all taken care of, right? There are these professionally engineered masks, garments, equipment, whatever the case may be. And all of a sudden, everyone had to scramble for that. And that's not something you think about when you think about American healthcare. You think about a lot of stuff, but you don't think I bet there's
Yeah.
going to be a supply shortage or something like that. It was really instructive. And I think it helped bring home the point. This is a big deal. This is something to be taken very seriously, and it's all hands on deck.
Yeah, and I realized it wasn't just America, it was worldwide. There were shortages, and there still are. That's why the price is still high.
Indeed.
But
Indeed.
also think about the people making those masks. A lot of those masks initially were being made in China, and there were a lot of people in China who also had COVID. And so even if those factories were open, it's hard to produce masks if the workers themselves are going through this disease.
So I think that the other thing that I think is really important to talk about, that I know it has been a trend in terms of 911 calls and emergency room visits, is the fact that what I guess you'd call traditional emergency care is down. You're not seeing as many people presenting with, chronic breathing problems, stroke, or heart attack, or whatever the case may be. And Lord knows I'm not a scientist, but there's nothing to explain that trend other than, I assume, people being afraid to show up, being concerned either that they're going to use resources that should go to someone else, or they're going to get sick if they show up to ED or call 911. Let's try to disabuse people of that notion.
Yeah, I appreciate the opportunity to do that tonight. I think we caused a lot of that because remember when this started, we canceled all elective surgeries. We did that for a couple of reasons. Number one was to make sure we weren't using any extra PPE when we knew we needed everything to care for the COVID patients. Again, because this disease can be highly transferable if you're not wearing it right. And number two, we needed extra staff working on these patients. So, there was a couple of reasons we had to do that. So again, the hospitals have been open all along, and we know Massachusetts is reopening, and hospitals are included in the phase 1, phase 2. So what's happened, I believe, by us, by canceling elective surgery. So if you were one of those people who had your colonoscopy stopped because of COVID, or your joint replacement surgery, or fill in the blank, how many things that were not an immediate emergency, I think that gave a feeling of being afraid to come to a hospital too. And so I guess I want to make sure people know COVID patients are in isolations with different air going in and out that's even filtered before it's released back out into the air. So it is very, very safe. I think people thinking if they go into a hospital and they're going to get COVID, they're very misguided. I personally, as a nurse who've been working in here every day since it started and have been out on the units, have not worried about catching it because, again, we have appropriate PPE. Initially, I was nervous going to the grocery store where there were a lot of people close by without masks on. You want to see me run, it's when I run into someone in the public who's not wearing a mask. Remember, that's to protect me. My mask is protecting them. I think it's appropriate for someone else then to protect me when I'm protecting them. So hospitals are open. We did see ED volume fall, and we did have patients say they were scared to come to the hospital. And the sad thing is there were people who came in with complications that could have been prevented. The fear they had of COVID, which again was misguided, actually caused other conditions to be worse that could have been cared for much easier on a quicker trip to the emergency room or a call to the physician. Remember, when you come in and it's a heart attack, for example, always call 911 with chest pain. Don't be afraid of COVID. You will be in the cath lab within 20-25 minutes where the heart attack will be stopped, that vessel that is blocked will be reopened, and precious heart muscle will be saved. Delaying things like this just causes other complications that are really hard to fix.
And that's the important part of it. We're talking about, in particular, critical care. These are things that you can't put off and you shouldn't put off. And the same is true with EMS response. Those folks are never not going to come. They're always going to exercise the appropriate precautions to protect themselves and to make sure that the patient is protected. So there's no good reason to forego care that you need under these circumstances.
Right. And, there's things that people consider routine care that, we've been doing COVID now for 11 weeks. That's a long time to put off other things that are necessary. And I started my career as a pediatric nurse. And so I always say, do not pass up those visits with the pediatrician. Those are so important to catch early developmental things or other stuff that peds is, there's so many variations. Passing up immunizations, not the thing to do. So those are things that aren't seen as emergency, but are so important to healthcare. I think it's important for people to know when they are missing their normal well visits. There's a reason hospitals throughout the country right away went into telemedicine. It's very low risk to get to talk to your doctor via telemedicine these days, and them to guide you. Is this something you should be coming into an office for, into the emergency room for, into urgent care for, or something that can be delayed? And your doctor is going to guide you to what is safest for you. So I love that telemedicine is a very common availability within our market now. I can tell you at Melrose Wakefield Healthcare, 60% of our physician visits right now are occurring via telemedicine. That also says there's other conditions going on that doctor has 40% of the time seen the patient in the office. So, I'm glad people are reaching out and talking to their physicians, and I would encourage that. But 911 for things like heart attack, chest pain, symptoms of stroke, minutes matter in those situations, and delaying just causes bad outcomes.
Yeah, the telemedicine piece is something that was slow to take hold, and if there is an upside to what is going on, it's that hopefully that can become part of the regular course of care. Again, not for folks, there's nothing that substitutes for doctor or nurse patient interaction, but there are opportunities to be safe, to use telemedicine,
Absolutely.
to avoid a trip into Boston or avoid a trip out if you're not feeling well. And
Right.
Sometimes you need a little nudge. And this is a heck of a way to get there. But hopefully that's something that will kind of get baked into the system a little bit more and be a real, care driver and really a savings too.
Absolutely. And actually, with less COVID patients in the hospital now throughout the state, hospitals are being allowed right now to really move ahead with high priority, either preventive services like vaccinations for kids, but also moving things that had been elective 11 weeks ago. Elective wasn't an elective procedure. A lot of times when people are getting them, it's not something that can be put off for a year or two, because quality of life and morbidity can be affected. And so some of those patients are now moving ahead, and that's nice to be able to get back to doing really good health care again. I would see more. I know people are asking, I have a friend who needs a shoulder surgery. It's not impacting the quality of life. It's not, and it's a necessary surgery, but it's not an urgent impacting quality of life or the long-term outcome. His surgery will get delayed yet, but it'll eventually I'm sure he'll get it this summer. It's just not going to happen next week.
Sure. And it's good to hear, because it is, pain and discomfort and corrective things are real and important, as you said, to quality of life. And it's good to hear we can slowly get back into that business, because that matters for you as practitioners. It matters for the general public who needs that care. Is there anything else you think we need to know? I've taken up a lot of your time, and you're probably the busiest person in the city, so I'll give you a few minutes to close and say whatever you'd like.
Sure. I would just like to let people know it's safe to go to the hospital. It's safe to go to the doctor's office. If you're nervous, call the doctor. Again, I see people out at the grocery store, a lot of places. Remember, when you're in a hospital, we take care of communicable diseases every single day. We're pretty darn good at it. We've got the PPE. We're going to keep you safe. And we have it right now. And we also do universal screening. There's a lot more done within the walls of a hospital to ensure patients are safe. And again, my top priority is to make sure my nurses, doctors, housekeepers, and everyone else stays safe. So we are in it for the right reasons, and there is so much good processes in place to ensure that People without COVID are not capturing COVID by walking into a hospital, but their real medical issues are being addressed and taken care of.
So I really want to thank you for your partnership, for your engagement with the community. You've been a terrific partner in planning how to navigate this. We certainly couldn't have done it without you. And the message that there's a lot of things we've talked about, but as we come out of the shelter in place or the stay-at-home order, reminding folks that the best way they can help themselves, the best way they can help you and your team is by continuing to do those important social distancing pieces, staying 6 feet away, wearing the mask, the good hygiene practices, all that stuff is how we're going to continue to bend that curve, continue to keep the community safe, and make sure that we can avoid a second surge as best we can and come out the other side, as you said, so effectively early. So thank you again for taking the time, and tell all the folks at Melrose Wakefield that the residents of Melrose very much appreciate all their good work over the last several months.
Thank you, Mayor. And I'd just like to also thank the residents of Melrose for doing all they could. We are in this together, and it's a pleasure to serve in a community that really has taken on this virus so well. Thank you.
Thank you, and have a great night, everybody.